We don't have a lot of extracurricular stuff yet. So it's 7:04. I think by 7:05, probably we should start. And so that in the benefit of time, because we are recording the session, so I think they can usually anytime go back and start. And it's a good thing to listen to the recording because, you know, you are listening live, you can get distraction here and there. But when you are seated by yourself and that's the only thing you're doing, it's a good thing to do. So I usually tell even the people who attend live, just sit and listen to it one more time. Make sure you didn't miss anything, and then you create your plan on how you're gonna do your things. So as you are coming in, please put your medical school in brackets in front of your name so that you know where you're coming from. Angela, Samira, Lynn, you know, just put your medical school in front of your name and let us know. We can quickly peruse where you're doing your training. Yeah, so I think punctuality is really a big part of this. And so starting timely and respecting those people who showed up, knowing that probably, you know, they're in between classes is the right thing to do. And Vivian and Caleb, thank you for organizing this and putting this together. Probably you can kind of open the floor and then, you know, we start going.
Thank you, Jim, for honoring our invitation and accepting to be here. We are very, very grateful. Also, thank you very much, Dr. Barbara, for taking your time to take us through this session. We are very hopeful it will be very impactful and enlightening so that people can actually start doing the USMLE exams. So thank you, thank you, thank you very much. Also, a very big welcome for the people joining from other universities. Karibu sana.
All right. Hello, everybody. Welcome on board. Can you hear me?
Yeah, we can hear you.
Excellent, excellent. Hello, everybody. Welcome on board. This is USMLE one-on-one to kind of just provide an overview of USMLE. So a couple of weeks ago, Vivian reached out to me. Is member of the students organization body there dealing with academics, and is like, I would like you to give us a session for us from University of Nairobi. And, you know, I didn't think about it. I said, yes. And then I started thinking about it and I'm discussing with my colleague and he's like, how can we make this better? So I went back to Vivian and I said, I'll do this if you advertise to other medical schools and we try to catch as many Kenyans as possible in this session. And then that's how we'll move along. And of course, she was like, okay, 100%, let's do this. And so we are coming to kind of explain this, but we have been doing this kind of talks, but really addressing people across East and Central Africa together. And so this is the first where we are doing country specific. And I was really happy to do it because, you know, I have a soft spot for Kenya in my heart. You know, after finishing my internship, I worked in Kenya for almost 2 years before I came to the US. I grew up in Kilimanjaro, which, you know, is closer to Nairobi than Dar es Salaam. Listening to Radio Kenya, you know, and all those things which goes around. And so I think I know more of Kenya, you know, than Tanzania, and they're in the border. So anyway, the colonialists put the borders. If they are not colonialists, probably would have been just, you know, one country. So, so I will kind of, the way I'm gonna go through this, I have a set of slides that I would like to go through. to kind of present my argument very systematically. And then as we are going along, if you have any questions, write them in the chat box. Barbara is here with me. She's PGY3 resident, and she'll be helping me kind of answering the questions in real time. And then if there is any repeating question or need explanations, she will point them out at the end. We'll go through and then we'll take the questions. So just take time to sink in and get the information. As you come in, try to write your medical school in front of your name so that you know where you are coming from. And just, and let's do this, and hopefully, we can have a good conversation and learn as much as we can. So just a moment. I think myself here. Good. Excellent. Again, good afternoon, everybody. Welcome to USMLE 101. My name is James Ignas Koola. My patients calls me Koola, but it's real pronounced the Koola. I'm used to Dr. Koola, and that's it. And, I'm born and raised in Tanzania, in Kilimanjaro, which is in the northern part, and did my medical school in Muhimbili, University of Dar es Salaam. Then it was part of the University of Dar es Salaam. And after internship, I worked in Kenya, in Kilifi, with Kemri Wellcome Trust for almost 2.5 years. And then I came to the US to do my MPH. And I started working in HIV drug and vaccine trials under NIH-funded grant in Africa, Asia, and South America. As I was doing this, I missed the clinicals a lot. And I was like, I feeling I'm incomplete. And so I decided I want to do clinicals. And so I put my head down, and in 18 months, I did all my exams, and I applied for residence. When I was applying for residence, I was like, I have all these kind of research, public health thing. I don't want to leave it completely, although I want to see patients. And so I was searching, what residence can I do that will enable me to do both? And then I came across internal medicine, preventive medicine. So I applied to that, and I matched here in Griffin Hospital, Derby, Connecticut. And I finished my residence, and then I came back. I work as an APD, Associate Program Director. So as I said, if you are coming in now, if you have any questions, just put them in the chat box. And, we will try to answer as we go along. And then at the end, we'll compile and answer some key questions and move on. So you are supposed to try to get your questions answered in real time. That's the importance of why you are here. This will be in the YouTube. You can watch it passively, but try to participate actively and make the most of your time. So since 2023, we have been doing these sessions whereby we found there is not enough information. There's a lot of psychological warfare going around and the people being scared. So what we try to do is really to go through in 3 sessions, 101, 201, and 301, to kind of introduce what is USMLE and what it entails. 201 to talk about how to study for the exam. Studying for the USMLE is a completely different ball game. You cannot just use Jaweds and Gayton and Ganon and be able to do the exam. There are USMLE specific materials and specific way to prepare. So we make sure that our people knows so they don't fail because of logistics, because they didn't know how to do it. And of course, and 301, we talk about residency application. How do you make your application stand out? How do you present forward your best foot so that you match properly? And so and this is the first time I'm talking to Kenya specifically. I think initial talk was to Tanzania, and then I decided, you know what, I'm going to open it for East Africa. And that's how the sessions has been. I'll always advertise across Kenya, Tanzania, Uganda, Rwanda, Burundi, and the like. And so, so I've invited my resident, Barbara Odak, who is a PGY3, and she's the one who will be answering the questions. The topics is wide, but we are starting, and people might have different levels, because I hear there are some other people who have even done their exams already. So if you find it to be very basic, sorry, it's meant to address for everybody. And the aim is to reach as many people as possible. We want to create, a pipeline of people who are applying through and kind of can succeed in the system and kind of match and be able to do their residence properly. So here, this is Barbara. I think this is when she was PGY2 or PGY1. We had a Christmas party with other residents. We had a ACP Connecticut chapter, and Barbara had a poster. So it's me near her poster, kind of supporting her and cheering her on. Barbara is originally from Jamhuri ya watu wa Kenya. She went to Jomo Kenyatta University. She was at Yale doing an MPH when she met our residents do MPH at Yale in their third year of training because we do IMPM for 4 years. And so she was working with one of the people who graduated and is like, oh, I have these students from Kenya. She's very good. She'll make a good resident here. We usually consider, recommendation from our residents because there are people who they're going to work with the people we recruit. And so we invited her, we interviewed her. She was very strong and we hired her. And here she is. Next year in July, she's going to be PGY4. She's aspiring to be a cardiologist. And so she's working towards that. And, and that's all about. So welcome, Barbara, and thank you so much for being here. And at some point, I'll give you a moment to talk and you can greet everybody. And this is what we want you to see, that, if you meet people online saying it's impossible, you cannot pass those exams, / you cannot match, here we are. We are living that it's possible. We have done it. It's not that we are extraordinary. We are just ordinary like you. And, it's good that you are knowing this early on in your career, because the sooner you do it, the better. And I'll keep emphasizing that. So back to business. We're going to talk about the graduate medical education in the United States, which is also referred to as residence. And a residency or graduate medical education is equivalent to MED, in the East African countries. And it's similar and different in many ways, because residency is done in programs. And the program where you do residence can be a community hospital, a clinic, or a university. So there are different areas where people do residence. And in East Africa, MED is predominantly done in the universities. And I put almost always in brackets because there are some areas where it's not real in the university. So unlike in East Africa, you finish 5 years of medical school, 1 year of internship, you go to practice as a registrar, whatever, a medical officer. In the US, after medical school, you go through residency before you practice. So we don't have registrars here. There are no medical officers in the US. Everybody practices as a specialist, either as a primary care, internal medicine, pediatrics, and the like, or as, other, specialists. And so the programs where you train are run by program director, associate program director, and they have program coordinators. So really, in most cases, the program director and the associate program director are the real people who interview and hire, but then they have other teaching faculties who works there. And the program coordinator is like the administrator who kind of will be emailing you, doing your coordination, your schedules, your intake, your visas, help you schedule interviews and all those things. So I said in East Africa, it's almost always done in universities, because currently there is this COSECA organization, which is training surgeons in East and Central Africa. And they don't have it's not a university where they recruit residency in surgery. They place them in different hospitals where they have preceptors, and they work through that, and they have structured exams, and then they accredit them as surgeons. COSECA is based in Arusha, and this is their website if you have not heard about it. So for graduate medical education, for you to gain access to US graduate medical education, you need to take and pass your USMLE exams. And any medical students in WHO accredited medical school directory can apply for USMLE exam. So the moment you come into medical school, you can apply for USMLE exams. And this is the website for the directory of World Directory of Medical Schools. And if you go in the website, you open the website, you can write your country, and all the medical schools in that country will list down. So example, when I ran this report, Kenya has 11 medical schools, and 3 of them are in Nairobi. So you can literally see all the Kenyan medical schools, 11 of them. So if your medical school is not here, probably is very new, it has to be here first before ECFMG recognize you as somebody who is studying in an accredited medical school. And so someone emailed me a few months ago asking me, how do I get in medical school directory? I don't know. I found Muhimbili there. I've never found out, just Google and try to find out. I'm not sure. I don't know that information, but they are very cognizant in adding schools. I think in 2023, there were almost like 9. There are 2 new medical schools in Kenya. So I saw there was a slight change between 2023 and 2025. When you are done with your exams, when you are done with your USMLE exams, then you apply for residence through ERAS. ERAS is an electronic residence application system. And then from ERAS, now you apply for match through NRMP, National Residence Matching Program. And NRMP has been there since 1952. So this will be 73 years that NRMP have been in place. And you saw, and it's actually, it's a computer-based algorithm system whereby after you interview, you kind of rank your programs, and the programs ranks you, and then they use computer algorithm to kind of match you. Actually, for people who loves movies, if you watch a movie, A Beautiful Mind is about a Nobel-winning economist and mathematician, is the one who developed the theory that they use for NRMP. So there's science behind it. And so before I engage in so many acronyms, ERAS, NRMP, USMLE, I hope by now you know that USMLE is United States Medical Licensing Exam. That's what it stands for. It's to be able to apply for all this, you have to apply, study, and pass your USMLE exams. So for you to do USMLE exams, the first step, like the background, step 0, is to get your USMLE number. That's the first thing you have to do. And before you do any application for USMLE number, you have to make sure that your names are in order, And it's good, I mean, if you have a passport or national ID, because then if you have a national ID, even if you don't have a passport, your name in your national ID will appear in your passport. And I think for you Kenyans, you have advantage. I'm assuming predominantly people attending here are Kenyans, because you get national ID when you turn 18. Tanzania national ID started recently, so we didn't used to have national ID. But what I want you to appreciate is you have to be consistent in writing your name. So if you have somebody called John Kiplagat in their certificate with single T and I, and John Kiplagat with double T and I, and John Kiplagat with double T without I at the end, these are 3 different people. So you have to make sure that your name matches to the latest alphabet, especially the first and the last name. And there are names which are subject to change because there are people, they're called Mohammed, others Mohammed with single M, other Mohammed with I at the end and single, other Muhammad, and other Muhammad. So these are 5 different names. So you have to make sure that there's consistency of your name in your ID and your medical certificate. When you take the exam, the passport is the only identification that you can use to take your exam. You cannot use your national ID. You cannot use your Kenyan driving license to take your exam. So if you decide you are doing USMLE, among things you have to do is to try to get your passport. But as you see, you can apply for USMLE number even with the national ID, knowing that your name is going to be the same. So what I found, in Tanzania, we are very casual with names. So for example, myself, when I was born, in my birth certificate, I have 5 names: James Ignas Bahati Tadei Koola. When I was in secondary school, I just used 2 names, James Ignas. When I went to medical school, they say you need 3 names. So I said James Ignas Bahati, but Ignas with CE, not Ignas with S. So when I went to USMLE, I decided I'm going to be James Ignas Koola. And of course, I did a deed poll published in the government gazette. I sweared and I said James Ignas Bahati, James Ignas Bahati Tadei Koola is now James Ignas Koola, and that's it. And so we have the same legal system in East Africa. We are all under the British. So if you have controversies, just settle them as you're a medical student. And as I said, you need a passport is required for you to take the exam. But you don't need a passport to get your USMLE number. You don't need a passport to start studying. So start those things, do things in concurrence, and then make sure you roll in the process to get your passport because you will need it to do your exam. So registration for USMLE number starts when you go to the starts from here, from the ECFMG website. That's where the registration starts from. And for international medical graduates, you can click this link and start registering for your USMLE number. And I'll advise, do a favor, and if you don't have USMLE number, do it today. Okay? You are allowed, as a medical student, you're allowed, you can start taking exams. So I'll try to explain. IMG, International Medical Graduate, it means is anybody who trained outside the US. It has nothing to do with US citizenship. You can be a US citizen, go to train in the Caribbean, or go to train in Eastern Europe, and you'll be an IMG. So this has nothing to do with legal status. It's about where you trained. You know, so they are recognized as international medical graduate, like they are not US or American medical graduates. So when you click where I showed you in the website, you will come direct to this page where you can use a USMLE number and password to log in. But when you are coming in for the first time, it means you don't have a USMLE number yet. So I'll show you where you start from. And ESFMG, like 2 years ago, they wanted to transition to something else. They failed, and so ECFMG is still active and working, and they're still giving USMLE numbers. So don't concentrate on any blabs online. You can, ECFMG website is still what works, and people are getting their USMLE numbers. So when you come, you will come here that you are a new applicant, you don't have a USMLE number, and this is your starting place where you're going to click to start the process of you getting the USMLE number. And when they click, they make you a test that you are doing this, you are using your name as exactly how it will appear in your passport, and they make you a test. You have to write your first and last name properly. John George is not George John. Those are 2 different people. So they make sure that you don't reverse this. And people will be excited, like home, they call you junior, but you don't have junior in your passport. And then you'll come here and you write, I'm John Kiplagat Jr., because that's your nickname they call you. There's somebody who did that, added junior to his name because out of excitement, and then they say, hey, your documentation doesn't have junior, because junior is a real thing that comes in people names. And so he had to kind of go reattest and change. So don't get overexcited and kind of do things that will kind of slow you in the future. They make you a test, that you read the information, what you are doing is true, and this is legally binding. And so when you do this and complete the process, it will take 5 business days for you to get your USMLE number. So the USMLE number you only apply once in your lifetime. It's the only number if you will use if you decide to pursue USMLE. The USMLE number does not expire. Never ever try to create another one. You can change your name, you can change your gender, you can change anything, you can change from married to single to married again. too complicated, but your USMLE number will remain exactly the same. If you try to go and apply for another number, they will catch you and it will not end well. So it's very important you adhere to that and don't try to do anything fishy. The USMLE number is free. You do not pay a dime to get the USMLE number. I'm guilty of gauging seriousness of people by checking when they pursue USMLE number. Before we started doing this, kind of organizing people through these talks, I used to get reference from family and friends. And somebody will tell you, oh, this is my cousin, is interested to do USMLE. I'll go about, talk to them, through WhatsApp, phone call, whatever, spend like 1 hour, 90 minutes talking to them, everything. And then a month later, I'll ask them, hey, do you have USMLE number? I say, there are some things I'm sorting, sijatulia, they'll give you this Swahili thing, sijatulia, I'm still sorting out things. And I guess my experience, those people, a month later, they don't have USMLE number. 99.99%, they will do nothing even a year after. So, so for me, I used to say in Swahili, say, mtoto sio riziki. And it's not like, it's gone. It's a lost cause, so it doesn't happen. So, it's really important if you're serious about this to go and get. And frankly speaking, I've continued to note the same procrastination. And I think in 2023, out of 650 people I spoke to, I think around 120 procured USMLE numbers. But, 60 people of these 120 are the people who listened online through the YouTube videos. So, so the digital world is helping us. People are listening and acting on it. People are listening. They are not doing anything, but that's really up to you. You have to make a decision and do what is good for you. So once you get, after 5 business, you get your USMLE number, then when you come back, you will click here where you're coming now with a new number to establish an account. And that's where now you're gonna establish your account. And then of course, and this you log in, now you have an account, and now next time you can come here, use your USMLE number and password that you generated here when you are setting your account to kind of move along and do what you're supposed to do. So once you establish an account, then you can start document verification. And document verification goes through your dean. And so ESFMG will send forms to your dean. And if you have graduated, of course, medical certificate and everything will be submitted. If you have not graduated, the verification will not include certificate because you're not graduated yet. And of course, this is a process which you don't have a lot of control. So as it's going along, it's good to do things in parallel. You continue studying. You don't need to wait for it to go through. It's just a matter of time, a matter of logistics. It will happen. Keep moving. So really the speed depends on the speed of your dean. Is the dean in office verified? Sometimes a dean who is verified, their term come to an end. You have a brand new dean who is not verified. And so some papers work have to be filled in. Or sometimes you find a school whereby the school is not yet in ECFMG list, although is on the World Director of Medical Schools. So some documents have to be sent in for the school to be verified. There is a new medical school in Tanzania, in Mbeya, a town in southern west Tanzania. They are kind of trying in the process of verifying. When Barbara was applying, she was the first to apply from Jomo Kenyatta. So she had to go through and make sure the school is verified, the dean is verified, and then she got her papers through. So sometimes you have to be a pioneer and lead the process. So the process can take around 6 months, so there's no reason to delay. And, if you do it when you're in school, then the better, because you can even walk to the dean office anytime, unlike when you are somewhere, in Northwest Kenya, where it takes like 2 hours of bus ride to go to Nairobi for you to follow up a letter for your ECFMG things to go through. So more importantly, why should you do it? The document verification process is not free. You pay $160. But when you verify your documents, those documents are valid for 7 years. So which means if you do your document verification as an MD2, you will finish 3 years of medical school, and then you will have 4 years post-graduation for you that your documents are verified to finish your exams. Now, if you know from MD2 about USMLE and you need to wait up to 4 years after graduation, you are not done, I don't think this is for you. So I think the longevity is enough. that people should start acting. And in real sense, you should be able, to do your things and kind of finish. There's nothing like you're too early to do that. Do not procrastinate. Make sure you do it. When you're in school, you can make follow-up quickly. It's very important. It reaches a point when you are studying and you feel you are ready to take the exam, but guess what? You cannot schedule your exam because your documents are not verified. That is very deflating. Don't sabotage yourself. Make sure you do things timely in such a way that you don't stuck in the bureaucracy. So USMLEs, you have to do USMLEs, right? For you to be able to come to graduate medical education. So USMLE step 1 is basic sciences, anatomy, physiology, biochemistry, pharmacology, pathology, all those basic science you learn in the first 3 years of medical school. It's a pass-fail exam. It's about 3 years ago. So there's a lot of basic science in the CK. So although it's a pass-fail exam, don't downplay it. Just give it your best shot possible, because the knowledge you accumulate while you are preparing for step 1 will help you to have a decent or very good score in step 2, which is scored. So you want to make sure that when you go to the scored one, you can really score well. And I'll kind of keep emphasizing, and I emphasize a lot when you talk about exam taking strategies. So although step 1 is basic sciences and you finish them by 3rd year, my experience is, according to how we study, you are better off doing step 1 after you have done at least 1 year of clinical rotation. It's because the step 1, although it's basic science, it's basic applied sciences, whereby at some point you have to make a diagnosis for you to make a correct choice for an answer. In the US, they do it after 2 years of medical school. Medical school here in the US is 4 years. But you come to medical school after you have done your bachelor degree. So you do bachelor of degree, let's say bachelor of science or bachelor of biology, and then you come to medical school to do 4 years. But from day 1, when they start the 4 years of medical school, they start going to the clinics. So they do integrated learning. Even when they teach them the anatomy, the physiology, they teach them the basic and the basic applied and the clinical. So they do all of them together. For us, in Muhimbili, in the first 3 years, I didn't see a single patient. So if you take it as MD3, you have not been to the floor, there are chances you might fail. And my recommendation is just wait till when you have done at least 1 year of clinical, you can integrate, and then you can do better. Step 2 is clinical knowledge. So this is internal medicine, peds surgery, the clinical rotations. And of course, there's AP and biostat. And the exam is predominantly internal medicine. 50 to 60% of step 2 CK is internal medicine. And the questions are 3rd degree level of knowledge, So they don't answer like ATP is manufactured in dash dash, you feel mitochondria. There are no those kind of 1st degree level of questions. So they are kind of, you need to kind of identify multiple things before you can answer. And I have this very good example I've shared previously that I'll take you through to give you a sneak peek of how the questions are worded. Before I took USMLE, I didn't respect multiple choice questions. When I took USMLE, that's how I discovered how robust MCQ can be, and they can really test your knowledge when they are written well. So there's this example of USMLE question. A 4-year-old African-American boy is presented to the hospital for the first time in 6 months. Previous 3 visits, he had swelling of fingers and a yellowish coloration of eyes. This time, he has pain below the knee of the left, X-ray showing evidence of porosity elevation. You are given different labs. Electrolytes are normal, has mild transaminitis, slightly elevated bilirubin. You see some anemia there, hemoglobin, low. The cell lines in the CBC are all normal. You say biopsy is taken from the lesion. What's the gram stain of the most common organism? So one thing you learn in the USMLE, they'll not give you a diagnosis. They'll describe it. So this boy, who is 4 years African-American, has had 4 visits. So he's kind of sick. You don't expect a 4 years to be coming in and out of the hospital. He had swelling of fingers. Swelling of fingers, it means dactylitis, but it's not telling you it's dactylitis. Now, if you have never been to the ward, you have never seen a pediatric child, and you have never seen dactylitis, there's no way you will diagnose it. And then is having yellowish coloration of eyes, means the child has jaundice. And now the X-ray is showing porosity elevation. What is periosteal elevation in the X-ray of a bone? It means is osteomyelitis. Now, this person who has jaundice, dactylitis, is African American, is being multiple admitted, what do you think? The child has sickle cell. So osteomyelitis in sickle cell, the common organism is Salmonella, which is gram negative. Now, so you're going to answer the gram staining is what? Is gram negative. But guess what? If you didn't know any of those, you'll be totally guessing this question. Now, when it comes to step 2, it must be the same stem of the questions, and it'll say, what is the next step in the management? So now you're talking about management. And so you have to figure out things, you have to make diagnosis, make some establishment, and the questions are long, and they put the labels and everything, and there's a lot of noise in between to confuse you, and then, of course, the question follows. So CK scores range from 0 to 300. The pass score is 214. The median score for American medical graduate in step 2 CK is 249. So for you, what you want to do is to beat that, or, to be closer to that, or be above it. You want to be above it. You want to beat the American medical graduates median. So most programs will filter people. If you have less than 230, they don't want to even talk to you. If you pass by 215, yeah, you passed the USMLE, but seems you have so poor knowledge. When programs will bring you in, we want you to be board certified. And if your medical knowledge is shaky, there's no way, you're going to be board certified, and that's a challenge. And for us, it becomes a burden. So we'll see you as a weak candidate. Your chances of matching will be narrowing down. So you'll be shown how to study. It's good that you work towards those numbers to increase your chances of you matching for residence. So you need to do step 1 and step 2 CK plus an English test for you to be ECFMG certified. There's USMLE step 3, which can be done after matching. But for IMG, sometimes we encourage you to do early, because when you have done, it increases your chances of you matching. It's not required though. Step 1 and step 2 CK can be done in Nairobi and Kampala in East Africa. So for you, University of Nairobi, you don't need to travel. You can take a matatu from home and go and write your USMLE exam. How easy is that? In Africa, the other 2 sites is Accra, Ghana, and Joburg, South Africa. So people from all other countries, apart from Kenya, they have to fly outside their country, and Uganda in East Africa, they have to fly outside their country or travel to go and do the exam. So this is even, an incentive for you why you should do it, and be able to complete the system. So when you do step 3, you can get a work visa, which is called H1B. You cannot get H1B if you are not done with step 3. So you'll end up with just a J training visa. So your visa limitation is limited if you're not done with step 3. But step 3 is done in the US. And so what people will do is they'll apply for step 3, then ask for a visa to come and do step 3 and do some clinical observership to strengthen the application and kind of kill 2 birds with 1 stone. This is an example of ECFMG certificate. I just took it from online. When you get ECFMG certified, you'll get some kind of certificate like this, showing the dates you take your exam. And it's with this certificate that now you can go to ERAS and apply for the match. So given the uniqueness of USMLE questions and the way to train, you need specific materials to study. Reading books, I mean, the Guyton, the Gannon will not cut it. So the materials, we have the materials. I mean, you can find the materials, and we'll show you. When we talk about 201, we talk just about how to study and what you need to do. And so we'll go into details into that. And Barbara will share a link for 201 for those people who are already in the process, have not seen it, to kind of where I delve into details, on how to kind of study for the exam and the materials and everything else. So the first aid is really the Bible of USMLE preparation. They publish it every year. You need to read it multiple times before you take the exam. Literally, you need to read it cover to cover at least 5 times before you take the exam. And by the time you are taking the exam, it should be no place to write. You have written your notes, you have highlighted everything, you have gone through everything, you understand it in out. You don't have really to go for the latest version, because the material does not change much. It's around $50 to $60. Amazon sells it. And if you go for previous, like a little bit of an older version. It's cheaper. You can get even as low as $15. But the key thing, you need to read, understand your book, and kind of, build it along. For those people still in medical school, MD1, MD2, you can have your first aid, you finish anatomy, you study anatomy in first aid. You finish microbiology, you read microbiology in first aid. And you keep reading as you're going through. And then when you come and rewind, it's easier. For those people who are really advanced, just go through, read it first as a novel, and then come back and start reading it, and then go about read them topic-wise. But, you need to read, and read again. So this is in Amazon, I think showing around $50. I mean, that's there. Now there are soft copies people can buy, and they tell me they can annotate. I'm an old school. I'm a paper and I wanna, when I read a book, I wanna flip pages. So I don't do well reading online stuff unless I'm reading for leisure. Why all these hassles? I mean, all these, long questions, you're gonna go take like 7 blocks or 40 questions each and 8 hours of doing exams. Why? Why all these hassles? Preparing for USMLE enhances your medical knowledge. You are able to integrate things more. A knowledgeable doctor is a better doctor all the time. You are confident, you can teach, you can lead. What I tell my residents is the eyes does not see what the brain does not know. You look, you see somebody has a rash, and somebody will look and say that is celiac disease. You look at an imaging, you tell somebody you have a mass, you need colonoscopy, probably you have a colon cancer. But guess what? It was an interception because your eyes, that's what they deceived you. So for you, as a medical educator, like I train and teach residents, I can tell when I have a knowledgeable resident and I have a resident who has a shakable knowledge. So it's really important when you know your things, you practice with confidence and you do things. And so USMLE, although you can be scared online, like it's the toughest exam ever, US medical graduates, 98% pass the exam in the first attempt. Only 2% fails. So the exam is not hard as long as you prepare and practice the way it's required. And this is the job of us. We are trying to show you how the way it is. And of course, as a physician, you have decided to come into this noble profession, or as a medical student, you want to be a physician. What you need to know is, as a physician, you're a student for life. COVID came, we have graduated from school many years ago. We learned about COVID, we took care of patients, and we moved on. So you have to learn every day. The moment you stop learning, that's when you start decaying. So for Tanzania, they have pre-intern and post-intern exam when they finish medical schools. For those people who are preparing for USMLE, they don't fail these exams. They pass them very well. So I've had people who had, if you want to practice, for example, in Namibia, they give you an exam. The questions are like, they are hard questions. I had a student who was preparing, a young doctor who was preparing for USMLE, went to Namibia, did the exam, crashed it in such a way that the board called him to give him a gift because nobody has passed the exam that much. And he's like, what did you do? And like, oh, I'm preparing for USMLE. 6 months later, he marched and left Namibia, came to the US. So it really gives you a solid knowledge and you can practice, you can use it anywhere. My colleague, Professor Minja, likes saying, when you study, it's just like being a football player. You can play in your Kombe la Mbuzi in your village where you play to win a goat, or if you are real good, you can play in the Premier League and La Liga, So when you have this good, solid foundation of knowledge and you come to the USMLE, it's like, and you come to residence, it's like moving to play in the Premier League, whereby, that's where you use your skills. So it's really important that, you look at it that way. There's this where you're in medical school, people will say like, you just pass a C doctor is just the same as an A doctor. That's a lie. Make sure you know your things. So remember I said residency is similar to MMed but different. Unlike MMed where you pay fees, when you march into the residency in the US, you start being paid salary. Someone is paying for you to get your education. How good is that? So while you are training to become an internal medicine physician, a cardiologist, and an electrophysiologist, somebody is paying you. And they get paid anywhere between $5,000 and $6,000 US dollars a year. So this is around 700,000 Kenyan shillings a month. So it's so 5,000 to 8,000 a month. So it's around 700,000 Kenyan shillings a month. So, so it's not, it's good pay, you get to do your things. You don't have to ask for fees from your parents and ask for pocket money and just get embarrassed. I mean, you're an adult already. Come on, be independent, So when you train in the US, you get exposure to highly specialized training. So you can take these skills back home, you can transfer knowledge, you can do real highly specialized training. As I said, you can do internal medicine, cardiology, electrophysiology, you can do neurology, neurocritical care, endovascular intervention. People do pathology, they do molecular, dermatopathology. So you can do really advanced training, and really, in real sense, it's a full cycle. You bring this training back home and kind of increase care to our people. And so as a US trained and certified physician, you can practice in many countries in the world without doing exams, because SHME is highly regulated. So they know physicians who come from being trained in this system, they are very good. And so in most cases, you can just fly to any country and practice. So you literally, you make yourself a global physician by going through this. So it's very important, and when you come to the program, the programs will support you. We want you to succeed. So that's why we are very picky when we are picking to bring you up, because we wanna convince ourselves that you have potential to succeed. You'll be a good resident, you'll be a good physician, you'll present us well, and that's what we are looking forward to. For example, in Tanzania, you'll find like, people go to MED and people get discontinued. So, and people rejoice on that, like, oh, they failed, we failed them. Here, we really want you to pass. And if you fail, we take it personally. And so we really prepare to make sure that you pass. So around the first weekend of February 2026, that's when we'll give this kind of talk, the USMLE one-on-one, and then, of course, we have talk coming to talk about study strategies. I mean, to share practices. I mean, how you can study and kind of pass well, and this will be for the people in the process. For example, if you don't have USMLE number, why should I tell you how to study for the exam? You have not even done the thing that is free. So that's the way we try to do. And for people who on 301 are the people who they are ECFMG certified and they're applying for residence. So as I said, we have a 2-1 talk about how to do the exam that I told Barbara to share in the chat box. So make sure you take the link. If you don't know about it, go and listen. If you're on the process, and prepare in the right way so that you can be ready to do the exam. So in the first week of May, we'll talk about with the people who have this year. We'll talk to the people who have ECFMG certified, how to apply, because in September, that's when they submit their application for interviews for residents to start in 2026. So at that point, that's when we give them from the program side, what are we looking for? How should you? So we are telling you beforehand, before you come to apply with your 215, where you pass by just one above, and you're kind of, why am I not getting interview? It's because you are a very weak candidate. Yeah, you passed, but you're not real strong. And so it's now that before you go there and kind of do those borderline numbers, you can juice up your thing and increase your chances. So get your USMLE number. That's what you should do. In 5 business days, if you apply today, you'll get your USMLE number. And when you get your USMLE number, please send an email to with your USMLE number. Forward the email from ECFMG to this email, usmlepursuit@gmail.com. Barbara, write it as well in the chat box. And so send your message, forward your email here, and then we'll invite you. And then we can kind of keep involving you, engaging you, helping you. I have a bunch of volunteers who help me go through your emails, answer key questions, but everything else, you need to be industrious. These days, Google has opened up information. Make sure you Google, search a little bit before you ask. Everybody is so busy, and we kind of, people strive to kind of help. So don't come and ask just trivial things just for the sake of asking. We don't run any social media group, because people will ask, okay, I want to be mentored. Can you add me to a WhatsApp group? No, we don't do that. So we just have this email where we'll communicate officially through email. These WhatsApp groups, people can sit there and kind of grandfather in there and they don't do anything. You need to study. And apparently studying is one thing, never mind how much someone loves you, cannot do it for you. It's something that you have to do only yourself. So convince yourself this is what you want to do, and then uh, do justice to yourself and kind of go through the process and do it. Don't lie to yourself. Don't sit on the fence and waste your own time. You have to decide and do. So our job is real to meet the people who have decided and show them, hey, this is how you prepare, this is how you make yourself appealing, and you move on. So while you're a medical student, explore opportunity to do elective in the US when you finish fourth year. For example, if you have been studying first year, you're preparing for USMLE, you have solid knowledge, you are a very good fourth year student, then get electives. Universities has collaborations. Look for those collaborations. Look for those visiting physicians when they come in, especially those who are coming from the US. If your interest is US training, uh, engage them, host them, befriend them, express your interest that, you are studying for USMLE, you want to apply. We had one panelist, a guy called from Uganda who was in Mbarara, and there was a neurologist who visited and went, I'm interested in neurology. And they say, yeah, do your exams and let me know. And he finished his exams and he matched at Mayo Clinic in Arizona. And that's where he did his residence. He did neurocritical care in Harvard, Massachusetts General Hospital, and is now practicing in Augusta, Georgia. So build positive relationships. Be there, be intentional in terms of encountering people, interacting, genuine. There's nothing that beats human connection. Human connection, like one-on-one connection, is the best tool that happens. So these are there are MD4 students from Muhimbili. Muhimbili has collaboration with Dartmouth. So they came to Dartmouth for a 6 weeks elective. And so I invited them down. I live near New Haven, Connecticut. So I invited them and I took them. This is in front of the Cushing Library. It's called Harvey Cushing Library. It's the library of the Yale School of Medicine and was named after Harvey Cushing, who was the neurosurgeon who kind of described Cushing syndrome, so in 1912. So it's a very memorable. I mean, everybody knows about Cushing syndrome and all those things if you have done your training, and it's really kind of taking them, inspiring them, showing them around. But that are the things you should be looking for to kind of establish and build relationships and because when you apply, you need reference letters. And so if you do, and when you come as a fourth year medical student, you really get to touch patient, present cases. And if you have solid knowledge, you're going to stand out. And this is how people will recognize you, give you very strong letters, and enable you, to move to your next life and pursue your career appropriately. So please note down the email. And when we have subsequent sessions, it's you being involved. That will involve, be industrious. Google before you ask. That's really important. Help everybody. Don't hide the information. Don't hide the information. Share information as wide as possible. The pot is big. This year, there are almost 43,000 residents who matched, and about 19,000 are international medical graduates. So the pot is very big. There's no way somebody will hinder your chances of getting into residence. You have different specialties. Somebody apply for pathology, surgery, internal medicine, pediatrics. You don't even whatever. So it's be open, share the information, find the right people who are in the right vibe and kind of, work through that and make sure you go through the process. Don't sit with the pessimists who are saying it cannot be done. It's the hardest thing ever known to man. 98% of American medical graduates passes. We are not less intelligent. And so I believe we can pass, and you guys, you are in the driving seat, and we are here to guide you and help you. And, God bless you as you go through, and hopefully, you decide to pursue, convince yourself and do it. I think I've come down to the end of my slides. I will welcome Barbara. If Barbara, you can come in and kind of introduce yourself to your people. And yeah.
Great. All right. Hello, everybody. My name is Barbara Odak. A graduate of Kenyatta University. Dr. Koola always says Jomo Kenyatta, which is okay. I'll take it. But I'm so happy to be here. This is like a dream come true because through my journey, I was always like, I hope nobody goes through as difficult as a time as I had going through this. So I'm so excited that you guys are interested and you're more than welcome. So currently, I'm a third year medical graduate, almost fourth year. I'm a third year medical resident currently in Griffin Hospital. So it's a Yale University affiliated program. I'm in a combined medical residency, that's internal medicine and preventive medicine. So that's a 4-year program other than the traditional just internal medicine, which is 3 years. So that means in my third year of residency, that's when I do my preventive aspect, which is essentially doing a master's degree in the Yale School of Public Health. But I graduated from Kenyatta University. Then went for my internship in Tenwek Hospital. And then I came to the US to start pursuing my USMLE career, which had its own road bumps. So when I came, I had no research done. So looked up how to do USMLE, and I didn't have any mentorship at that time. And then I realized that Kenyatta University was not even in the World Directory of Medical Schools, and it was a road bump because when I started Googling how to make that happen, I realized that it was very hard for me to do it from here because it involved getting the school to sign a couple of documents. But thankfully, someone had started doing the process. And within a few months, it opened up and I was able to register for USMLE. And I was so happy at that time. I didn't know that was the beginning of the huge journey ahead. So I started studying for USMLE, and at that time it was a graded score. And USMLE carried step one, carried the bulk of it was like the entryway into whether you would get interviews, whether you would get matched. And so I really wanted to do internal medicine, and so I really targeted for myself a certain score in mind, and I really wanted to get that score. Thankfully, there are resources like if you do the NBME, which is essentially like they're free resources, either paid resources, where you can kind of gauge what you will get in the step exam. And then, so I did that. And at least when I felt comfortable, I did the exam and I passed. But then next challenge came, COVID came. And with COVID, all the USMLE centers closed and there was no word on when they would come back. So here I am, I'm studying for step 2, but I don't know when the exams will come. So my morale was so low. But at that time, I always knew I wanted to do public health for sure. Even when I was in KU, I got engaged in a couple of activities, like medical peace work, if you've heard of it. So I got opportunities to travel and I went for conferences and research exchanges in Germany. So I always knew I wanted to do public health. So when that time came, I applied for an MPH. I started my application, and I was so crazy that I applied to Yale. That's one of the only schools I applied to for my MPH. I don't know what I was thinking. In retrospect, I would have applied for more schools. But God is good. Worked on my application, and then I got into Yale. And so when I got into Yale and into a specialized program, it's a 1-year accelerated MPH program, which has maybe like 30 students around the world selected. So I applied, got in. I haven't done my step 2. Thankfully, the centers opened up just before I was starting at Yale. So I did my USMLE step 2, passed, and now it was going into the rest of the journey of USMLE while navigating doing my MPH. So all the challenges Dr. Koola has highlighted, I went through. After I finished step 2, it was now about getting all my documentation in line. Mind you, nobody else from Kenyatta University had done this before. So now I have to tell the dean, okay, I need this documentation. I need an MSP. And they're just like, what? But God is good. Everything worked out in November. when everybody else is applying in September, in November, that's when I finish everything. But that's when, thankfully, I got linked to Frank, who was a current student at Griffin Hospital, and got in touch with him. And through him, I was able to get an interview, and I matched into this one-of-a-kind combined residency program. So essentially, that was my journey then. But when I was applying, when I was getting my documents ready, I remember I had people look through my personal statement, at least 3 people, so that I could make sure it's okay. And that just brings into the concept of mentorship, having people who have gone through the journey before so that you don't have to struggle. At least I know this year, the second graduate from KU matched into residency. So I'm so happy about that. But also getting mentorship, getting people on your corner to just look through your documents and see, hey, what can I fix? And I'll give you an example. There was a student who came to do an observership in Griffin Hospital, my current residency. And he was from India. He had done his USMLE Step 1, USMLE Step 2, and finished them while he was in medical school. One of the most, I would say, aggressive in a very positive manner people I've ever met in my life. Did all his USMLE exams, and then he applied for residency. And it's not easy to do that, especially coming from a program which is not USMLE based. But he did. He applied for residency, but unfortunately, he never hit matched that year. He used that year to look for observerships, and so he was able to come to the US, and he did maybe at least 3 observerships. And I'm not, right now, I'm doing a lot of work outside the hospital, so I don't interact much. But the one time I interacted with him, he was like, yeah, I saw your talk. I did a talk. I did a journal club in the hospital. And he was like, oh, yeah, thank you so much for your presentation. If you're doing any research, please let me know. And he hounded. If I say hounded, he hounded me down until the time I was presenting for a presentation, the one you've seen the picture that Dr. Koola presented. He was like, yeah, can I help you with this? So he helped me, and he added this onto his CV. And one of the interview questions that came up was actually from that research. They're like, okay, we see you've done this work. Could you tell us more about this? And so that actually featured in his application program. And when he was doing his final paperwork before he submitted for his second time applying for the match process, he was able to send me his documents. He sent me his personal statement, and I saw it, and I was like, no. In my head, I was like, this is not going to cut it. So I had to stay all night long. I think I slept maybe past midnight that day, just working on his personal statement and giving him feedback so he could go and review it. And he was so shocked because he was like, I've given this to other people, but they haven't given me this feedback that I've gotten. Because one thing you have to realize is you need a good story. You need a flowing story. It's not just random things you're putting there. No, you need a flowing story that shows, hey, well, I'm actually interested in this. Yeah, and so he worked on it, and he even rewrote it better than I could have ever written it, because he was like inspired, like someone could actually put in the effort to help him out. And happy to say, last Friday, he found out that he matched at a Yale affiliated program, which I am over them when I think I'm probably happier than he is that he matched. And these are stories of people. People go through tough times, but with the right mentorship, with the right persistence, consistency, you can be the most intelligent person in the world, but if you're not consistent in your preparation, you're not consistently trying to see what new activities can I add on to my CV, you're more than just the books that are there, you will make it. And as Dr. Koola said, when I finished all my USMLE exams, another hurdle I didn't even mention was that I had to now apply for the match, and you had to go to the NRMP, which is one of the registration places that you have to do. Went there, finished all my USMLE exams, so I'm going to actually put in my applications now to have myself added onto the match process. My school is not there. So I just wrote them an email, and I'm like, I've written step 1, I've written step 2. My school is not showing up in this list of schools there. But thankfully, this is America where things work. my school was added on, I think either the same day or the next day, and I was able to register for the match. So this is just for you. You do not have to face these particular challenges that I did. You just have to be consistent. If this is something that you really want, set your goals, prepare, and you will make it. So that's it from me. Thank you so much.
Thank you very much, Barbara. You know, it's good to hear it from the lion's mouth. Caleb, Vivian, anybody with any question? I mean, we are here. We can. I see there was a question about application. I mean, competitiveness of a job. I mean, US they need physicians. So physicians literally, I'll tell you when I finish, and I've never written a job application letter. When I go to an interview as a physician, I'm interviewing them more than them interviewing me. I mean, what do you get? Why should I come here? So it's because, I mean, there's so much need. And so once you finish your training, really, it's just you choose. What depends is what geographical location you want to stay in, you know, and there's a little bit of pay variability, but you get more than enough to live, depends on how greedy you are. And so literally, you know, you can be anywhere and that should be fine. There's somebody who's saying has done step 1, is doing step 2, is looking into orthopedic surgery. My request is just look on we have a statistic. I think I was talking on the 201. I have a slide which is showing about different specialties and the scores, which for the American matched and did not match. Orthopedic, dermatology, plastic surgery, they are highly sought of. They get the best of the best. Not if you have 220, you won't be to be an orthopedic surgeon. It's just because the other top people likes it, you know? So what I'll give an example is when I went to medical school in Muhimbili, we just had 2 medical schools. And what used to be is we have Form 5 and 6 in Tanzania, and those people who go to medical school are the people who study PCB. So the people who have Division 1 in PCB, which is real hard to come through, are the only one who will go to medical school. Not that if you have Division 2, you won't become a physician. I had people who went to Poland, China, and they became very good physicians. But it's because other people who are more deserving are there. So it's an issue of competition. Just make sure that your scores are reflecting. Make sure, you know, you have the experience and the research. Because one thing people look for from the program standpoint when we recruit is at least you have a clue of what you're applying to. You don't want to bring somebody in for radiology and then they read like 100 X-ray a day and it's like, what is this? This is not life. I don't want to do this. So we want you have been there, you have seen that, and kind of you know what you are coming into, because what freaks out from the program standpoint is somebody coming in and 3 months down the line saying, you know what, this is not for me, I'm out. You know, it disrupts so much schedule. People were doing Q4 schedule, now start doing Q3. From Q4 to Q3 is a completely different animal. People will break out, it's not fun. So it's really just make sure that your scores are beating those. If they are not, reconsider yourself and think again very seriously. That's what I'll say. Any question? Everything is understood, crystal clear, no question. You're here, you know, you better get more than somebody who will be listening on YouTube.
There is one question in the chat box from Elizabeth. She's asking, how soon after sitting for step 1 and 2 is one able to match?
Yeah, so your match, so everything goes in a cycle in the US. So the errors opens, I think people start taking tokens around June, July. That's when you apply that I'm applying for the match. So you will pay for what they call tokens. And then the programs start looking at the applications in the third week of September. For this year is September 25th, when the U.S. medical school deans release what they call Medical Students Performance Evaluation, MSP letters, which is kind of the overall letter from the dean's office for their application. So when they release it, this year it will be September 25th. That's when program start looking at the application. So we start looking at the application on September 25th, and then we'll interview throughout to January. And then for you as an applicant, you rank your programs by February. And then in March, the second Monday of March, you will know if you have matched it or not. And then if you have not, you're allowed to do SOP. And then on Friday, the results are released. It's a match day. So last Friday was the match day. So if you go to social media and put hashtag March 2025, you'll see stories about the match for 2025. And so, and then you match on that third week of March, and then they start the new residence starts on July 1st. But in most programs, they'll come 2 weeks before to do orientation, so that July 1st, they are starting their rotation. So every year, the cycle goes the same. So if, let's say, you finish everything in November, then you are not able to apply until the tokens comes out in June. So you have to look at those timings just to know how you pace yourself and you target like when you're going to apply. And the key thing is, what we have looked through is you require at least 18 to 24 months from when you decide like you are doing USMLE for you to go through the exams to be able to apply. So it's not something you can decide, oh, I'm applying in September. Now you have not done anything. There's no way you can apply in September. No way. So look through, everything is kind of cast along those lines, and you have to look through and pick and decide what you want to do. That's why it's really important for you to be true to yourself, hold yourself to the deadline, because just a slight delay might mean waiting for another year.
Thank you very much for that. There's another question in the chat box. Any from Stephen Kami. He's asking any recommendations for USMLE experience.
Any recommendation for United States? So clinical experience, that's what I said. As a medical student, try to see if you have collaborations where you can kind of go as a medical student, because as a medical student, you're allowed to do more. For example, there are people who your parents are paying for you. So you can go and Google and explore programs that allow medical students to come in, because like when the Muhimbili students were at Dartmouth, they learned there are students from all over the world who are coming independently. So you can pay, you can explore and pay for those programs and come and get that clinical experience, establish those contacts, and that counts as your US clinical experience. So it's a matter of knowing and putting your resources in the right place. I mean, if you don't have the funding to do it, probably you're good to kind of exploit the relationship you have, like the school collaborations that they have. And so, or / you can pay for it and do it. So those are the way, and there are multiple avenues. There are multiple programs that offer observerships and the like, and that's where you do. But when you come after you have graduated, you are really exposure to patient is limited because you're already a graduated physician. But when you come as a student, you can do more. Barbara, you can fill in if there's anything you want to fill in.
Yeah, I'm typing in the chat here.
So a university transcript considered when matching. When you apply, you put all your transcripts comes in, your medicals, your dean writes a letter to you. There are countries which we know everybody gets A, there are countries which you know everybody gets C, but guess what is the standardizing issue? Is your USMLE. So your USMLE will show where you are, and in real sense, you have passed your USMLE. I don't care about the C you got from University of Nairobi. You know, you have a 255, you have a 260, you're a solid candidate. I don't care that somebody was mean to you and gave you a C in pediatrics and a C in surgery, and you have a C in biochemistry. I don't care. But if you have A's all along and you have 215, there's a problem. And that's a bigger problem. because I mean, it means your medical knowledge is shallow, and whatever I'm seeing is not really the reflection. The USMLE is so standardized, is so good in standardizing, there's no way you can cheat around it. So does research for Kenya count as much as research from the US? I mean, any publication, you do research in Kenya, you publish in accredit, in journal, is in PubMed, is searchable, nobody cares where you did the research. Really, research is one thing that does not count where you do it. As long as you publish, not those, you do like, you know, your local research, you don't publish anywhere, and then you kind of say you're doing research. So just make sure you publish, that's fine. Because what does it do? It shows that you are academically rigorous. When somebody publishes, what it communicates is that this person can start something and finish it. So even if we come here for residence, he'll start and finish. There are so many people who will start writing papers that they never submit or they never go through to complete it. So it has processes, and what it shows is that this person is determined, is a goal getter, get things done, and that's what it portrays for you. We're not looking for a researcher to come and write grants. We're looking for somebody to see patients. But remember, most of these programs, a big chunk of them are academic programs. So it means you can succeed in academic life. And so it gives you that extra advantage.
Oh, could I kindly add on to the research one? When I was in medical school, there was a doctor, he was a pathologist. He was doing research on medical student views on taking pathology. And I just remember doing the surveys in class, and then I handed it to him. This whole thing turned out to be a paper. So then I added it on to my application when I was applying. So even small things go a long way. So long as it's published, it's published.
So there's somebody asking, is there a time limit of doing USMLE after graduate from medical school? Apparently there's none. Even if you're 70 years old, you can start USMLE now. Will you match? That's a question for another day. Your chances of matching decreases as your year of graduation increases. That's why it's really important, if you're hearing this as a medical student, you make an effort. The ideal candidate is when you finish your internship, you are ready to put in your application. You're a fresh graduate, you'll have so many open for you, because more other programs, they filter. Because these application, people send mass application in droves, they'll filter and say, year of graduation post 3 years, we're not gonna see. Or post 5 years, they're not gonna see. So you don't wanna fall into those. So you wanna try to do as soon as possible in such a way that you are accepted into as many programs as possible. And you have to know, in the US, you cannot discriminate against age. If I'm 60 years old and I'm graduating from medical school today, I'm a fresh graduate, and I'll get chance to match than you who's 32 years old and you're 8 years post-graduation. You are an old grad. I'm not. So it's the year of graduation that counts. It's not your chronological age. Of course, I mean, there are programs that when you look through, and this is the importance of meeting people who have applied and everything and kind of looking through. There are programs you look through for the past 10, 15 years that have not recruited any international medical graduates. They don't need to. They think, you know, they can fill with US medical graduates, and that's fine. So you don't waste your money there. I think $26 was per program. I'm not sure what the amount now when you apply, but in real sense, you know, you can look through, and you look through other people who have gone. Where did you interview? And you give priority to those programs, because we have unlimited resource. You can apply to as many programs as you want, but then it costs to every program that you apply to. So you want to make sure you put your money where your chances are high, and you should be, you know, ready to do to be accepted in interviewed, and of course get a slot. So as you are going along, this session is being recorded, and I'll ask if Vivian will send to me. When you recorded for this session, you put your email in there, so we have your name and your email address. I'll share the recording of this from the USMLE Pursuit email, and that's where you'll send your USMLE number if you're already in the process, or if you get it new, so that we can kind of, you know, we have groups there, people who have passed step 1, people who have passed step 2, people who are ECFMG certified, people who have matched. We are kind of building a cohort, and that's why you can ask your questions and get help, I mean, and move along. Yeah. Anybody want to ask a live question? We have 7 minutes, 7 minutes. 8:30 here, I think 3:30 there. I'll have to hang up. I'm on service and I have to kind of go and start going through my patients with my residents. And so that's why I really came early, starting at 7 a.m. so that I can be able to squeeze this in and then move
Hello,
on to
Dr.
that.
Can you hear me?
Yes, I can hear you. Caleb, was it you?
Yes, I have a question.
Go on.
I would like to ask if perhaps I've published a paper in general surgery, and when the time comes to match, I'm trying to match maybe into another surgical specialty, say for instance, cardiothoracic. Does that paper still count?
So in the US, there's no way you come to residency and do cardiothoracic right away. That's a super specialty. So you first go through general surgery and then you transition into cardiothoracic, vascular, all those kind of GI surgery, all those things. So yeah, so it's but as I said, it's not mostly about what you publish, it's the perseverance to go through the process that makes you count different from the people who have not published. Because you had to go through multiple processes. The US system kind of involve a lot of you applying yourself. And the way you go through the application process, if you are somebody who does not follow instruction, you're not industrious, you will not be able to go through the system. So the way they put the system even, it kind of filters out. There's a lot of people who got lost in the middle because they don't know how to figure out things and they just get lost. So the issue of publishing is only the mere thing that you published, meaning that you follow things through, that makes you stand out. It's not even about what you published.
Thank you, understood.
Yeah. Barbara, it seems we have a quiet crowd. I used to think, Kenyans, you'll be vocal, you'll come in and chime in, but I think everybody is simmering in and kind of trying to assimilate or slash. I hope we are not too basic, somebody got something to show for your band or your data that you use, but look for 201. It's really very detailed about how to study. It's really important you do those timed tests and kind of you can use. And USMLE is one exam, which when you go to write it, you can know 100% if you're passing or you're failing. So the issue of pass and fail is clear even before you write the exam. Because if you are scoring, depending on how you score in your NBME, you're in the pass score, you're just going to pass it. That's why 98% of people passes it here in the US because they train that way. And so it's one thing. So give yourself, don't try to, you pay for $1,000 for exam and then you don't have $60 to do NBME that is paid for where you can assess yourself and see exactly where you are. That's not right. That's a bad use of your money. So make sure you kind of follow through, listen to 201 really clearly, take notes, follow through, you pass well, and then you kind of have all the options for you because then you're a competitive candidate. And it's in that where you can see different specialties, as competitive the specialty, the more score because more people want it. And that's it. Vivian, I think, we are 8:28, almost 2 minutes to go. I mean, if you have some last words, I think I will, guys, leave you on the dot and move on to see my patients.
We want to first of all say thank you very much, Mr. James, for taking your time and taking us through the session. It was very enlightening. So many people have learned so many things, and we're very grateful. I also want to thank Dr. Barbara for taking her time, taking us through the session as well, sharing her experience. They usually say you see far by standing on the shoulders of giants who went before us. And clearly that is what we have been doing today, trying to see far through your steps because you have gone through us before us and you have also gone through the system. We want to thank our participants very much for listening and participating actively. Though we would have wanted more questions, but it's okay. We want to tell Dr. James that we are looking forward for having another session, especially for the people who will have their USMLE IDs. So we can do maybe a month later for people to actually have their house in order, get their USMLE numbers so that we can have a session for them and then maybe a session for the people waiting to do step 2. We had some in our audience and we are very proud of the progress we have been making. So thank you very much. Asante sana.
Barbara, some few words of thank you, Vivian. Some few words, to say bye-bye to your people.
Oh my gosh. Okay. Sorry. I think I was trying to answer a few questions on the chat. I think if you have an answer, just feel free to send your questions on the email, usmlepursuit@gmail.com. But I'm so happy that we've gotten to this stage where actually Kenyans are coming on intentionally to the USMLE world stage. So many people are doing it out here. I would love to have more of you come if it is what you want. And I can't thank Dr. Koola enough for his diligence. I mean, he had to wake up at like maybe 4 a.m. to be here and to prepare, and he's so diligent, and I'm so grateful for him. I pray more of you come and match so that we can beat this 113 South Sudanese or Sudanese match number because we're capable of doing it. We have such good education. We just need to focus it into studying the USMLE way, and we'll make it happen. So thank you. It was such a pleasure, and hope to see you here when you match.
Yeah, so thank you, Barbara. Thank you so much for being there. And it's to see is to believe. So, you see is one of your own. And so that's good. I mean, so the essence is be industrious. I mean, share the information, help others. I mean, it's a great opportunity. Frankly speaking, I was really discouraged when I moved into my clinical years. My seniors, my professors complaining, you are not being paid enough. I'm seeing my patients are dying. I don't have medication. I have this mother whom I remember the face up to now, and it gives me nightmares. She had eclampsia, and I didn't have magnesium sulfate, a salt, to give her to break down the seizure from eclampsia. To practice in an environment where, I have everything at disposal. I'll have my 98 years old, has pneumonia, has hypertension, keep on pressers, whatever, and get them going and they move on. And it's a beautiful thing to do everything by the book, everything you want to do by the book, you can do it. And it's practicing medicine in the best way possible. But the most important thing is really the knowledge that you get, the skills, especially when you come as young, you can do super specialty and do those. As I said, I started studying almost 10 years after graduation. So by the time I'm finishing my residence, my children are in middle school. I don't want to move them around, go and do a fellowship. So I just decided, I'll just be a generalist. I'll do it in another life. But, life is 360 degree, but you are young, you're starting your life. You can be real highly trained and then transfer the skills. So my colleague, Professor Minja, has started a neuro interventional radiology fellowship training in Tanzania. Actually have even some Kenyan training there. So it's a way they're transferring the skills. They can do interventional radiology. You have a kidney stone, they can go get it out. You don't die of sepsis from the kidney stone and you live to die another day. So it's really important. And always look forward to give back. There's somebody asking us about hobbies and things we do. It's not about us. It's really about medical education, USMLE, and what you are able to do and kind of, and if that's the training you want to get and position yourself there. So before this session started, I told Barbara, in our group, we had 5 people apply this year, 4 matched. So we are 80% kind of match rate. And I was looking through Sudan, despite all the wars, they are going through 113 people matched. So in 2 to 3 years, you Kenyans, you have to surprise us. We have like 100 Kenyan marching into residence, 100 Tanzanian marching into residence, and people moving on. So we are here cheering for you. Be industrious, look, ask real pressing questions, but don't fear to ask, and and move on, and all the best. Thank you, everybody, and good luck, and all the best in your careers. And from going forward, I mean, we will continue with the same talks like around November, one-on-one, East and Central Africa, around February 2001 about application process, those who has USMLE numbers, and in May, those who has ECFMG. So I think this is the one and the only that I'm doing specific for the university. And I told Vivian that. So it takes a lot of time and effort, and we just want to do as one time and bring up along together. Thank you so much, and all the best.